Okay, welcome to the Initiating IV Therapy MPC demonstration. So I need to verify my order, and on my electronic medical record I noticed that there is a new order for an IV, so I need to get my equipment. So I'm going to gather 2 Gelcos, an IV start kit, some extra 2x2s, a ChloraPrep, some alcohol wipes, some spare tape, and a protect cover just in case. Okay. And then I'd wash my hands here and head on into the room. Gel. Hi, Mr. Pooh. Your physician, I'm Susan, your nurse, and your doctor has ordered us to start an IV on you today. So let me just check that you're you. Winnie the Pooh, 1929-569. Winnie the Pooh, 1929-569. Okay. Always good to know we're in the right place. Okay, have you had an IV before? Yes. Okay, do you have any questions? Nope. Okay, well then let's just get started and get this thing in. All right, I like to sit down when I start my IVs. So I'm going to lower your bed just a little bit. Put this rail down. Okay. Just get my stuff together. All right, so okay. So this is my IV start kit. It expires 10 of 2014 and the package is intact. Let's just take a look here, see what I can find. Is that a comfortable position for you? Okay, well, that looks like that might be a good spot. So I'm going to put a tourniquet on here. It's non-latex, so don't worry if you have a latex allergy. I'm going to lift your arm up here. Okay, this is going to be a little tight. Okay, and pump your hand a couple times for me. Thank you. All right. Okay, nice and full and round, no hard spots. Okay, that looks like a really good spot. Put some gloves on now. I need to get some tape out first. Okay, so I've got my occlusive, and I want to use the tape in the kit, touching it as little as possible, hanging it so it's not touching anything. Tear this piece in 2. Yeah, that's the end of the tape. All right. And this is ready to go. All right, let's go ahead and put our linen protector down. I'm sure at some point I was supposed to do that, but don't see that on my MPC at the moment. Okay. All right, Mr. Pooh, I need to just raise your hand up here so I can put this down. case if we get any blood, we won't have to change your whole bed. There we go. Alrighty, let's get some gloves on, because we wear gloves for everything these days. Okay. ChloraPrep, it expires 12 of 2013, so it's good and the package is intact. Pop it. Okay. Alright, I'm just going to clean this for 60 seconds so we don't get an infection from the IV. Okay, there we go, 1 minute. Alrighty. So I have a Protect IV Plus. It expires 2 of 2016. Package is intact. Here. All right, Mr. Pooh, I'm going to move your arm over a little bit. Okay, so in just a second you're going to feel a stick. I'll let you know before I poke you. Okay, poke. Flash back, lower, forward a little bit. Thread, pull back till it clicks. Pop. Okay, we're all in, Mr. Pooh. Do not move your arm. Good job. Okay, so I'm just gonna hook you up to your IV tubing here real quick. Okay, once again, real important you don't move because I don't have that taped down and I don't want to poke you twice any more than you want me to poke you twice. Okay, I'm just going to clean up the little bit of blood that came out when we hooked you up to the tubing. Okay. And just pick that off with a 2x2. Make sure it's nice and dry. Okay. All right, I'm going to tape this down. Top. And then we'll put the bio-occlusive on. Okay, we'll keep that because it's got our label on it. All right, take one of the 2x2s from the kit. This piece of tape. Okay, so we are nicely taped down and everything is secured. Okay, let me get this IV going here. So I'm going to take a glove off, turn the power on, and according to your MAR, it's normal saline. So I want a rate of 80. TBI of 920, and clear the VI and start it. Okay, 2 drops. And you can try and pick up all your supplies with one hand gloved if you'd like. However, if you touch the bloody stuff, that's a contamination and fail. So my suggestion is put your other glove back on. And lift your hand up, Mr. Pooh. And that way you don't have to worry about the fact that this is bloody and that you've got a sharps that you want to keep separated from the bloody stuff. Thank you, Mr. Pooh. All right, let me just gather all the trash up. Put my sharps away. Use my other hand. Okay. Then let's put your rail back up so you don't fall out. And let's chart. All right, so on Winnie the Pooh, I did a start, and it was a new order, and the time was 12:30, and my initials, and the location is his right forearm, RFA, and it is in his median vein. And I used a 22 gauge. So the type is Protect IV Plus. It's a 22 gauge, 1 inch. Took me 1 attempt. I used a bio-occlusive. I used primary tubing. I did not put in a filter, and I used a pump. And sign it and initial it. Okay, thank you very much.